NAU is going to build a College of Medicine that's NAU through and through. It will be accelerated, affordable. It will be oriented to producing the kinds of practitioners who will have a deep commitment and be well prepared for providing primary care in our rural, most underserved communities, inclusive of our indigenous communities. The shortage of primary care physicians in Arizona is far more pronounced in the non-metropolitan areas of the state. Secondly, it's both a problem of numbers, how many practitioners we graduate, but also a problem of retention. So what we hope to do is to create a program that will prepare the practitioners for practice in those rural, underserved communities, as well as create practitioners that have resilience for what really is a challenging arena of practice so that we can increase the retention of the graduates in Arizona. Dr. Baldwin is a phenomenal leader. She's an internationally recognized expert in health equity. She has developed a research center here at NAU that is internationally renowned. We look forward to her bringing all that expertise, her great wisdom of leadership, and her extensive connections in the communities around the state that we want to serve most importantly to this project. Timeline. We have a most ambitious president. There are some steps we have to take. The most immediate next step will be once Vice President for NAU Health, Baldwin, starts. She will be convening our Medical Education Advisory Council this spring. The next step will be to begin the very preliminary steps of securing accreditation and getting consultation to develop a detailed operational plan and proposal so that we know exactly what will be needed to put the college in place. From there, it's about an 18-month process to get to a point to be able to advertise and admit students. It's time, given the size, the complexity, and the ambitions of the school, for it to be its own freestanding college. That will give them the autonomy to be far more agile and responsive to the needs of the state and to the dynamics in the profession. It will strengthen our ability to recruit the most talented and mission-focused faculty. It will help us establish the most robust kinds of partnerships throughout the state. We also hope that it'll strengthen the position of the College of Nursing in developing relationships with philanthropic organizations as well as alumni, and ultimately to secure some more philanthropic support to support our students so that they can have access to our outstanding nursing programs. Well, we're elevating health profession education by expanding it, of course. We're looking at expanding in a number of different locations: Yuma, Tucson, Flagstaff. In addition to that, we're elevating our training practices by putting in place two very important simulation centers, one here in Flagstaff, one at North Valley, that not only will be a resource for all of our health professions programs, but also will be a resource for practitioners and health systems around the state. Personally, I'm excited about all of it. I feel like NAU and all those in our university that have been working in these areas have come to a significant milestone. I want to acknowledge the incredible contributions of leaders and faculty over many years to get us to this place where we are in a position to do this. Among many leaders, I want to mention specifically Dr. Ramona Malott, a longtime leader at NAU, Dr. Lillian Smith, the Dean of our College of Health and Human Services, and Dr. Janina Johnson, who's been leading our School of Nursing. In addition to all that, I have to say that we are at a moment where we have the benefit of inspirational leadership in Dr. Cruz Rivera. He, as our president, leads with high aspirations. He has a profound commitment to Arizona as well as to the university. and he has a capacity to perceive how our assets can truly propel us forward. We wouldn't be able to be in this position without his phenomenal leadership.